back. My name is Chelsea and I'm a pelvic health physical therapist, and today's video is number 4 in a series of videos, the top 5 reasons to see a pelvic floor physical therapist. So we're nearing the end of the series, and today's video is specifically about pelvic and abdominal surgeries. So if you've had a pelvic surgery or an abdominal surgery and you're noticing some discomfort, or you just don't feel like you're functioning like you did prior to surgery, keep watching to find out more in this video. There are so many different reasons why someone might need to have an abdominal surgery or a pelvic surgery. Some common ones that come to mind are a C-section, so giving birth via C-section, a hysterectomy that can either be done vaginally or through the abdomen. Sometimes they will use some instruments to assist through the stomach. Also, something like an episiotomy can be considered, a pelvic trauma or a pelvic procedure, because they are cutting through muscles that provide support. So an episiotomy is whenever during a vaginal delivery, sometimes the provider will cut through the pelvic floor muscles in order to give a little more room for the baby to come out. Even things like colorectal surgery, so someone who has had colon cancer or rectal cancer, a rectal prolapse. So a rectal prolapse is basically when the rectum starts to come out of the anus itself. So there are many different colon and rectal conditions that could lead to a surgery. Another surgery that comes to mind is a prostate removal, so a prostatectomy. This would be, someone who has had prostate cancer, and there's a need to completely remove or partially remove the prostate. They could definitely benefit from some pelvic floor physical therapy. So that's just a few examples. There's so many different examples of an abdominal surgery. Sometimes even like an appendectomy, getting your appendix taken out, can be reason to see a pelvic physical therapist. So why would somebody need to see a pelvic therapist after some of these surgeries? People have been doing these surgeries for a long time, and it's not routine that you are referred to a physical therapist after a surgery like this. However, it probably should be. If you think about any orthopedic surgeries, if you have your knee operated on, or your shoulder, you're pretty much going to be referred to a physical therapist to help you get back to where you need to be. So if you're noticing any type of dysfunction or just not feeling like yourself after an abdominal or pelvic surgery, it is important to consult with a physical therapist. So one reason that you might want to see a physical therapist is scar tissue. So this could either be sensitivity to the scar, so it feels burning, itching, discomfort, pulling. It's very uncomfortable to the touch. This happens a lot of times after a C-section. Moms will say to me, the countertop hits right at my C-section scar and I can't stand something touching that. That's absolutely something that we can work on in physical therapy. Besides the sensitivity, you may even have, actual thick scar tissue that can be causing problems. So whenever you cut through tissue, a scar forms, and that scar tissue is going to be a little different than the natural tissue. It's going to be more dense, not as flexible, and that can sometimes cause problems. It can almost, or it does, adhere to the tissue underneath. So it gets stuck to the tissue underneath and it doesn't glide well, and that can be painful for people. So we can actually help soften that scar tissue, break it up, teach you ways to help soften the scar tissue, and that could be a scar on your belly, or that could even mean like a perineal scar. So whether you had a tear during childbirth or an episiotomy, that can create scar tissue too. So we can teach you how to soften that scar tissue, and that can make a big difference for someone who's having pain in the area of their scar. It's important for those scars, whether they're on your belly or your perineum, to move well in order for you to be able to function as well as you should be able to. Another reason you would want to see a physical therapist after having an abdominal or a pelvic surgery would be just to regain strength and regain range of motion. So when you have a surgery, the muscles around the area that was cut into automatically shut down or stop working as well as they did prior prior to the surgery. And that is an immediate effect right after surgery, because basically your body goes into protective mode and it doesn't want any more injury to happen in that area. So it just kind of freezes. So you can think about that, like if you've ever had a knee surgery, as soon as you wake up from surgery, the quad muscle, specifically the muscle on the front of your thigh, will be almost like dead. It's hard to make, hard to make a muscle, and you can actually even see muscle loss happening. You can tell that one leg looks smaller than the other. So it's very important to rehab that. So why would it not be important to rehab your core and your pelvic floor after you've had a surgery that cuts into the muscle, or even just cuts into the other tissues? A C-section might not specifically cut through your abdominal muscles. Most of the time they're able to separate the abdominal muscles to get to your uterus, but there's still some trauma that's going on in that area, very obviously. Other surgeries do cut through the muscles. So if you do have some type of, insult or injury to that area, it's important to rehab it to really get yourself back as comfortable as possible and as functional as possible. We're talking about regaining range of motion. That just means making sure that your back can move as far as it naturally can. Can you bend forward all the way? Can you bend back all the way? If you've got any tightness through those muscles or through the tissue, we can help work on that. And then, of course, building strength, that just goes back to what I talked about the muscles kind of shutting down. So strength and range of motion is very integral for good function. So that's what we're looking at, and it's very important to take care of that after a surgery. If you can't make it to a physical therapist in your area, if you don't have access, then I would highly encourage you to try just some gentle movements, gentle breathing, and really just get mobile after a surgery. Of course, wait for your provider to clear you. If there needs to be a period of rest for, wound healing or something like that, absolutely listen to your provider. But as quickly as you're cleared, I would really encourage you to get moving. Your body's going to want that motion, and it will really help with the pain from having your abdominal or pelvic surgery. In summary here, there's a lot of different reasons why you might want to see a pelvic therapist after surgery. And if your provider doesn't refer you to pelvic floor therapy or pelvic therapy, please go ahead and ask them. Say, I'm having some of these issues with scar tissue. I feel like I don't have the strength that I had prior to surgery, the range of motion, or, I'm having pain. And they can absolutely make that referral. In most states, you can just reach out to a physical therapist on your own. In the U.S., we have something called direct access, so that's something to look into as well. But yes, it's very important to continue to build strength, continue to get that range of motion back, and to really work on the scar sensitivity after your surgery. If you've had any type of pelvic or abdominal surgery, please comment below and let me know some of the issues that you ran into, what you wish that you could have done in your recovery to make things better, or something that you did do in your recovery that seemed to help quite a bit. Thanks for watching, and as always, if you have any questions, please leave them in the comments, and I hope that you enjoyed watching this video and it gave you something to think about. Thanks.